Hi, my name is Annie and this is our bright idea. So as from Tuesday the 9th of September, we are switching to BARD or BD catheter trays, which means everything that you need to catheterise a patient with will now be in one place. What we're planning to do is about 3 to 6 months into the delivery of the project is then to really start to look at, have we been able to reduce catheter related infections with the change in the system. It will save staff time, obviously, because it's not that it's recognisable and it's really difficult to attribute cost to that, but we will be saving staff time. Having everything packaged in one place will obviously save money. Environmentally, it should also be good. We've got one company delivering on this rather than a multitude of products coming from multiple different areas. But using a pack rather than individual items should give us a cost saving. So this is what will come. So rather than staff going to have to search for all the individual items, they'll have their gloves, they'll have their sheets, they'll have their apron, and then inside they'll have everything that they would normally need to use. So they'll have lubricating gel. There's an empty syringe if they need to deflate the balloon on an existing catheter that's in situ, water to inflate, and then they'll have their saline to cleanse. And then additionally, they will have their catheter, which is attached to a leg bag or a urometer, with catheter straps, and also the fixation device. So what is also very important about these new catheters is the red strip there, which as long as it's sealed means that this bag won't need to be changed for 14 days. Yes, so we had lots of differing clinicians that met with us right at the very start of this project to look and see with the urology team what products did we want to consider using and what do we feel was as the best evidence out there for the products that we also want to use. You have to have the specialist input of procurement and your buyers, without a doubt. They're the ones who do all the background work. They look at the costs, they discuss everything and negotiate everything with the company, supply chain. You couldn't do what you do as a clinician without them, but what I would do is encourage any clinician that thinks that if they've got another way of delivering a piece of equipment or an item, a clinical item that they want to use, and they think it could deliver even a cost saving, let alone be good for patients, to have that discussion with procurement, because they will certainly help.